Hello and welcome to PHM 613. For today's class, we are going to look at economic evaluation. And to be able to really discuss this topic, we are going to look at it from three learning objectives. This means that by the end of this module, you should be able to describe the role of economic evaluation in healthcare, and you should be able to describe guidelines for conducting an economic evaluation. And then lastly, you should be able to use the concept of economic evaluation, applying that to decision making in healthcare. So this lecture is going to be broken down into two, and there's going to be, I'm going to do a lecture video for each of these learning objectives, so that it kind of helps you in kind of break it up so that it's not one main thing that you're just looking at. All right, so starting with the first learning objectives, on which we're going to look at the roles of economic evaluation. So, starting strong, what is economic evaluation? So there is a 2005 definition that looked at it as economic evaluation compares the cost and consequences of two or more alternative healthcare interventions. So this way of comparison is backed up by a set of tools, with its main aim being to improve the value of money that is being invested in healthcare. So to kind of break that down a little bit and make it a bit more comprehensive, what economic evaluation does is a comparative analysis of first the cost of whatever actions you want to take. For instance, conducting an intervention or choosing between two or three interventions, and it kind of looks at cost from either it's a direct cost or it could be an indirect cost. An example of direct cost would be, let's say, the amount of money that is spent in procuring medical equipment, and an example of indirect cost would be, for example, loss in productivity. So it kind of looks at it from that cost perspective. But also it looks at the consequences of these alternatives. So it could either look at it in terms of whatever total cost that is used in implementing an intervention, or it could look at it from the angle of what is the effectiveness of the intervention if it is implemented. So to illustrate that, with a diagram, we have a choice. Let's say we start with this choice, and in order to implement this choice, we could either use program A to be able to do that, or we could use program B to be able to do that. And economic evaluation will look at this comparative analysis. Will look at taking into account what the cost of implementing program A is, but also what are the consequences of implementing program A. Similarly, it's going to look at what is the cost of implementing program B, also what is the consequences of implementing program B. So this kind of use an example that is a bit less abstract. So let's say we have a target population group that we're trying to provide treatments to. So we could either go with our standard treatment, something that's we've been using all this while, or we could introduce a new drug therapy. So in order to decide which of the two to go with, we need to look at the costs. Now, let's say the cost of a new therapy is $1 million in order to introduce the new therapy. Meanwhile, the cost that we've been using for the standard therapy is $350,000, $250,500 per annum. So we're kind of spending every year, this amount of money is being spent. So you might think, oh, $1 million compared to $350,500, oh, that's an easy decision, but it really isn't. First of all, the cost of 1 million may be more fixed in terms of we're just going to spend that money and we're not going to keep on spending it. Meanwhile, the 350 is a recurring expense, and we need to, put that take that into account. But beyond just looking at the cost, we also have to look at the consequence. In this case, the consequence would be what is the impact of this new drug therapy on health status, and what is the impact that it will have on cost. Both the costs of both the cost to the organization as well as the cost to the people that are going to use the drug therapy. And we could measure this consequence by either survival or quality of life, or we could look at it in terms of hospitalization or using other drugs. Same way that we can measure the consequences of standard treatments by looking at it in terms of the consequence, impact on health status as well as costs. So we can look at it this way. So this is a simplified way of looking at conduct, what it is to do an economic evaluation. So economic evaluation asks a lot of questions, or before we decide whether there is a need to do an economic evaluation, we usually start with a question, and some of these questions could be, should we adopt a new drug, or should we adopt a new surgical procedure? This is, being more clinical, or do we do a medical procedure, a clinical procedure versus doing a health intervention? Are they both worth doing by themselves or combined together? Is it worth it to spend extra money on an experimental procedure, or should we kind of invest money in a new technology? Let's say a specialist hospital, a specialist in a hospital comes and says, "Oh, I want to establish a new plaque transplant program, and the reason I want to do that is because it is cheaper to use this transplant program than doing constant dialysis." So economic evaluation would help in determining whether this claim is actually, what it is. Another kind of decision that would come up would be trying to determine what the clinical effectiveness of a program or intervention, and you could do that by identifying or estimating what the health outcome would come from doing that, or looking at what would be the cost of adopting this new innovation. So, and the reason why these questions come up is, why these questions come up and we need to make choices is because, which is the basis for everything that has to do with health economy, is that there is limited resources. There's just not enough money to use for all the wonderful things that we want to accomplish. There's just not enough money. And so our inability to put in resources into all these desired outcomes is the reason why choices have to be made, because there's so much that we want to accomplish, but there's not just enough money for it. So choices has to be made in which direction do we go to versus the other. So economic perspectives, economic evaluations can take a couple different perspective in terms of how are we looking at it. It could either be a private perspective, in which case we are trying to consider the individual perspective, and the individual, let's just for example here, would be a member of a population group, and we could look at, when we're doing our cost evaluation, we could look at it from, what does that look as, for someone who is from a high socioeconomic status versus someone who is from a low economic perspective status. Sorry. So it's kind of looking at it from that perspective. We can also look at economic evaluation from an organizational perspective, in which case we're kind of trying to consider the cost of running a clinical practice, or for instance, the cost of implementing a health intervention. So we can also look at, economic perspective from a societal perspective. An example would be, when we're doing that from economic societal perspective, we're looking at all the costs that will be associated with carrying out this intervention to everybody in the or society, or even a subset of the society, and what benefit will come from it, benefit in terms of societal benefit that will come from it. An example would be the annual free shots that usually is covered by Medicare. So there's a cost benefit that was done, and so rather kind of evaluated the benefit of the Medicare covering the cost of the flu shot versus pushing that cost to the individual people to bear. So that's one of the ways of looking at it in terms of societal perspective. So, what is the purposes of economic perspective? Economic evaluation. There are a couple of them. I'm not going to go through everything, but just kind of give you enough information to kind of fill in the gap, in so to say. So, economic evaluation helps in guiding decisions in terms of deciding what is the most appropriate mix of strategies and what is the best way we are going to allocate these scarce resources, like I mentioned before. It also does help in providing an overview of the total amount of resources that can be used to start, expand a program, or even continue running a program. And also, it also look at it in terms of what is the evidence available for the effectiveness of said intervention. It does help in the discussion of what the relative efficiency or equity of a program is. Like the example I gave with the individual perspective, where we're comparing someone from a high economic status versus someone from a low economic status. You could use an economic evaluation to look at, okay, so these two programs, these two choices have relatively the same benefits, but who is having the benefits more than the other? If one of them has benefit goes more to people from a low, from a higher economic, socioeconomic status versus those who are in the lower economics, socioeconomic status, you kind of want to look at it in terms of equity. What is the health equity or health equality that comes from doing this program? So it does help. Economic evaluation does help managers in deciding what the most appropriate way to deliver a particular intervention, in which case now it's not just looking at resources or cost in terms of money. It also would be looking at it in terms of the energy or the time and resources, human resources that would go into implementing said health intervention. So the economic evaluation, helps us in providing information on advocacy. We want to advocate for new health innovation and new health technology. We kind of use economic evaluation to help in pushing our case to say, hey, we have evidence that this is a better intervention versus whatever is existing, or this is a better technology versus whatever is existing. So that's what that does with economic evaluation, and it provides evidence-based information to donors, to policymakers. Because one of the things that happens with policies is that we do policy analysis, and a lot of policy analysis uses economic evaluation for it, in trying to make a case for, okay, this is what this policy was originally designed to do, but is it really doing that? And or do we need to modify what those policies are? So an economic evaluation helps us to be able to make that decision or to answer those questions. So I did talk about efficiency just a while ago, but there's a way economic evaluation looks at. Let's just, for example, it's measuring efficiency. It could either do it from a technical perspective, or from technical point of view, or it does it from an allocative efficiency. So with a technical efficiency, it is concerned with producing the giving. Is kind of looking at, we have a, let's use for example, we have a level of output that we want, and we want to know what the minimum cost of getting this output done. So I'm going to use a very simple example. Say I have a table that I want to move, and I want to look at what is the costs of moving this table, what is the least amount of money that I'm going to pay in order to move this table. So I would be taking, let's just, for example, quotations from different people. Let's say one person says, I'm going to charge you $2,000 to move this table. And another person says, I'm going to charge you $1,500 to move this table. So I'm likely going to go with the person who says, $1,500, because it's smaller than the $2,000. So that's kind of where technical efficiencies are kind of looking at. You could also look at it from in terms of the maximum amount that can come from from a given cost. Let's use, for example, in this case, I have $1,000 and I'm trying to move a lot of tables, and I'm looking for who is going to move the most table for this $5,000 that I have. So let's use, for example, someone comes and says, I can move 10,000 tables for this amount, which is $5,000, and someone else comes and says, I can only move 7,000 tables. I'm going to go with the person who is moving 10,000 tables, because that's the maximum output that is coming from my fixed amount of money, or from my given cost. So technical efficiency is concerned with efficiency within a program. As you can see from the examples that I gave on the table, it's kind of around the same thing versus which I'm going to talk about, the allocative efficiency. So that's how that goes. So an example of a technical efficiency would be, say we want to provide diabetes type 2 educational intervention, and what we want to get out of this intervention is for retention rate. We're looking for high retention rate, and let's say we've decided that the retention rate that we're looking for is 80%, right? And so we're trying to measure, are we going to get 80 retention rate if we use a nurse practitioner to implement this program, this educational program, or if we use peer support. So that is an example of technical efficiency. So for allocative efficiency, we're kind of looking at it from different programs competing for an allocation of the scarce resources. So I'm going to give you an example so that you understand that. So an example would be, say we have an intervention program for children with autism spectrum disorder, and we're trying to decide how we are going to implement this intervention. Should we use pharmacological therapy? Should we use behavioral therapy, or should we use a combination of the two? As you can see, there's a big difference between how you implement a pharmacological therapy versus how you implement a behavioral therapy, and the benefits from them can be quite different. So it's a lot more complicated. Let's just, for example, we want to move a table. So allocative efficiency kind of looks at it that way. And another example of an allocative efficiency would be, say we want to improve health outcomes among African Americans, and we want to decide, okay, do we focus on alcohol and substance abuse, or do we focus on accident injury prevention? As you can imagine, both these interventions will be vastly different in the way that we implement the program, with vastly different benefits out of it. So that's kind of gives you an idea of how allocative efficiency is, and how that kind of differs from technical efficiency. All right. So, um, just as I've kind of alluded throughout this course, this lecture so far, economic evaluation does not solely focus on the cost of healthcare. It really goes beyond that. And this is because the way we kind of justify, or the way that we look at healthcare, the spending that is done on healthcare being worthwhile, is kind of looking at it from what is the benefits of a given goods or services, those goods or services that we've decided to go with, versus the opportunity cost of putting those resources into an alternative. That we want the benefits to be greater than the opportunity cost. To kind of break it down a little bit, I mean, what is in terms of opportunity cost here, looking at what the benefits that is foregone from using the same resources on an alternative, right? So let me break it down a little bit. Let's say the benefit that we'll get from going with choice A is A plus. Let's use that example. But the benefit that we lose from going with choice A is choice B plus. Because if we decide to go with A, remember, both A and B have their benefits, right? But if we go with A, we are going to lose out on the benefits from B. But so we want to make sure that the benefit from A is greater than the benefit that we lost by not choosing B. So that is how you kind of look at whether spending is worthwhile or not, from a very purely technical perspective in terms of health economics. So in order to do that, we need we require a lot of information, right? Information on the costs and consequences of all our available resources for all the alternatives that we have. Of course, sometimes it's difficult to have all of it, but we want to get as many as we can get. In order to do that, that will require identifying what those alternatives are and looking at it in terms of what are the types of resources that we're going to need from it in order to do those, and what are the possible outcomes. We want to be able to measure what these resources and consequences are, to kind of have a way of measuring what they are. And then we need to then determine the value that will be placed on both the consequence, right? And the value could either be in monetary terms, like cold hard cash, or we could look at it in terms of utility. An example would be hospital readmission rates, right? And then finally, we then compare the costs and then compare the consequences of all of these alternatives in order to make a decision on which of them to go with. So, what do you need to know in order to conduct an economic evaluation? The first is, how do you collect the data that you would use? Remember, with economic evaluation, you need to get as much information as possible, both on the cost and the consequence, which requires doing data collection. So data collection can either be through a randomized control trial, or it could be a non-randomized control trials. Or instead of doing a primary data, you could decide to do a secondary data by using already existing data. An example would be the technology assessment review. So you can kind of check that out if you're interested in what that looks like. So data collection can be either prospective or it can be retrospective. So prospective means as the study is going on, you are collecting the data, or retrospective means it's all done and now you're collecting the data. So when it's prospective study, it's typically primary data that we are collecting, but for retrospective studies, it can be either primary or secondary data. So what are the different types of economic evaluation? So we have four main types of economic evaluation, and they kind of look different in terms of how they're measuring costs and how they're measuring consequences. So starting with the cost minimization analysis. The cost minimization analysis is, it kind of measures the least costly among the alternatives that are, and in order to do this, it's assuming that the benefits is the same, right? We have 5 options. The benefits from these 5 options are absolutely the same or very close enough that we can then just focus on looking at the cost. So it's assuming that, because all the alternative, the benefits from all the alternative is the same, we don't have to measure those. We can just focus on measuring the costs. So please read this study that I included. It uses cost minimization analysis to look at diabetes intervention. And then another type of economic evaluation is the cost benefits analysis. So the cost benefit analysis attempts to identify, quantify, and compare the cost and benefits of a program. So with the cost benefit analysis, we are no longer assuming that the benefits are the same. We're saying the benefits vary as well as the costs vary. So in order to come up with a choice, we need to measure the cost as well as measure the benefits. So cost benefit analysis assigns monetary values to both the cost and the benefits, so that this way it allows to do a direct comparison. So I've also included this study. Please read it to kind of get a sense of what cost benefit analysis is in real life. Also, this study is from a diabetes type 2 program. And then the third one is the cost effectiveness analysis, which is the one that most people have heard about. It's one of the most commonly mentioned. So with cost effectiveness analysis, it's really measuring cost per unit effect. An example would be cost per life saved or cost per disability avoided. So that's what cost effectiveness analysis is kind of looking at. So it tries to measure efficiency in different interventions, and it does that by calculating what the cost is versus whatever unit of measurement that is using to determine the consequence or the health outcomes or the desired output. So I've also included another paper that looks at cost effectiveness analysis also on a diabetes type 2 program. And then finally, we have the cost utilization analysis. The cost utilization analysis is actually an offshoot of the cost effectiveness analysis, but with the cost utility analysis, it focuses on measuring the quality of life as a unit of measurement for it. So that's the difference between just the general cost effectiveness and utility analysis. So and the measure that it uses to come up with utility is the quality adjusted life year, and that's what is used to measure the cost utility analysis. So and QALY, it's kind of it's the way it's determined is a multiplication or a product of the number of life years affected with the quality of any 1 year, any life year. So that's how QALY is measured. So I've also included another study that looks at cost utility analysis also. This is kind of focused on also diabetes intervention. So that's where we end for the first learning objectives. It's kind of lengthy because there's just a lot to cover, and I wanted to give you guys as many foundational information as possible, so that when we get to the second learning objective and the third learning objective, you'll be able to more easily follow through what it is that we're saying, that I'm saying rather. So I'll see you guys in the next video where I will talk about the second learning objectives. Okay, see you soon. Bye.